Are you having pain in the front of your shoulder or down near your elbow? Well, you might have bicep tendonitis, so check out this video. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of Oakland Health, and today I'm going to discuss a real common injury that people that work out tend to get. And what is it? It's called bicep tendonitis. And oftentimes it presents in one of two ways, either pain in the front or the anterior part of the shoulder or pain down near the elbow. So before we go any further, let's take a look at the anatomy of the bicep brachii. So the biceps brachii, or we're just going to simply refer to for the remainder of this video as just the biceps, gets its name from the fact that it actually has two heads. Both of these heads originate off of the scapula, or what we commonly refer to as the shoulder blades. First off, we have the long head. Now this portion of the bicep actually attaches to what's called the supraglenoid tubercle of the scapula. And this tendon is so long that there's actually a groove in the humerus that this tendon runs along, and the groove of the humerus actually is there to help keep this bicep tendon in position so that it doesn't swish around and move around too much. Then we have the short head, which actually comes up and attaches to the coracoid process of the scapula. Both of these heads come down and converge into what's known as the belly of the bicep, and it inserts in what's called the radiotuberosity of the radius. And the radius bone is one of the two bones in the forearm. All right, so that's the anatomy of the biceps. What's the biceps do? The biceps flex the elbow, and they also supinate the forearms, which is turning the thumbs out. That's why when you're working your biceps, particularly like say dumbbell curls, what do you always hear? You want to curl the dumbbell up, and at the top you want to supinate. You want to really turn those thumbs out. That gives a full contraction to the bicep. So, what is it about the biceps when we exercise that cause so many cases of bicep tendonitis on people? Why do people come into my office, anterior shoulder pain, elbow pain? What is it about the bicep? Now, I used to think, well, these people must just have tight biceps. The tight biceps are tugging on the tendons. I used to think that. However, over the years, I've been doing chiropractic for over 28 years, treating soft tissue injuries. I've found that there's actually two main reasons that cause people to develop bicep tendonitis. So what are they? One, tightness in the pronator teres muscle of the forearm. This is the muscle of the forearm that actually pronates the forearm, which is the opposite of supination. Tightness in the pronator teres. Second, tightness in the internal rotators of the shoulders, muscles that actually internally rotate your shoulders. We're dealing with the subscapularis, which is one of the four rotator cuff muscles, the pec major, the latissimus dorsi, the anterior delts, and the teres major. These are internal rotators of the shoulder. They tend to get tight. So let's talk about each of those, talk about how to loosen them up so that we can avoid bicep tendonitis. First off, the pronator teres, let's talk about that first. Quick, before we go on, quick look at the anatomy. Okay, so here's the pronator teres. The pronator teres actually has two heads at the top. The humeral head, which is the larger of the two heads, originates off of to just generalize it, it originates off the medial epicondyle of the humerus. That's basically the inside of the elbow. And then the second head of the pronator teres is what we call the ulnar head. It originates off the medial side of what's called the coronoid process of the proximal ulna. Now, both of these heads converge to form the pronator teres, which passes obliquely across the forearm, and it inserts at the middle of what's called the lateral surface of the body of the radius. That's the one of the two bones that make up the forearm. All right, so that's the pronator teres. So why is this muscle causing us so much trouble in regards to our bicep and causing bicep tendonitis? Well, in regards to the pronator teres, that's what causes some of the lower bicep tendonitis that's causing elbow pain. And why is that? The pronator teres pronates our forearm. What do we do most of the time during the day? What's a more natural posture for people? We're in pronation. We're at our computer. We're using the mouse. We're at the keyboard. We're driving a car. We're sitting like this in a chair. We're at a desk, or just reading something, reading a book. Most of the time, we're holding our phone or something. We're most of the time more towards a pronated position. When are we in a supinated position? Unless you're Italian like me and you're talking with your hands and you're supinated as you yelling with the rest of your family, because that's what us Italians like to do. I mean, you're not usually in a supinated position. You're usually pronated. And so what happens when you're in a pronated position, the muscle fibers, that pronator teres is in a shortened position. If you leave a muscle in a shortened position, muscle fibers get shorter. And when they get shorter, that translates into tightness. So we have these tight pronator muscles this way. I mean, just sit like I am right now. What's more comfortable? What's easy to do? If you turn your hands this way in full pronation, or if you try to turn into full supination. I don't know about you, but when I do this, I actually have to really make a conscious effort to try to pull my forearms into supination, where I can easily just flop them into pronation. It's a much more comfortable position because of the fact that those pronators, and people, including myself, often get tight. This is more of a strain to do this. So why is that important? Well, think about it. You've been at your desk all day, you're working at your computer, now you decide it's time to go work out, you don't warm up that much, you hit the gym, it's bicep day, you grab a bar to do bicep curls, you immediately are forcing those forearms into supination with a weighted bar pulling down on you. So I'm basically taking those tight muscles, I'm forcing things into a supinated position with weight, or even worse, if I'm hanging from a bar, like I want to do some chin-ups, once again, I'm forcing the biceps into supination, and I have the body weight pulling down. That you go to do some curls now in this position without warming up properly, and that tendon down here of the bicep gets irritated. So what can we do? Well, one is to, of course, warm up properly, but two is you may just have some really tight pronator muscles that you need to do a little work on if you're currently been suffering with bicep tendonitis down here, or if you've noticed you're really prone to bicep tendonitis. Those pronator teres muscles need to be worked out and loosened. So we need to do some rolling techniques on that muscle and some fascia release techniques. That's what I'm going to show you right now. Okay, so you've noticed recently you've been prone to some bicep tendonitis down here. You go to supinate, you can just feel the restriction, the tightness. Let's do some work on that. First off, we got to do some rolling. We're going to get a foam roller on that pronator teres. I don't think so. We got to use a massage ball. We're going to use a Tai Chi ball from OkraMed Health. Because of the texture, it's going to get deep into the fascia. And as we looked at earlier, basically that pronator teres is coming off of the inside here. One heads off the humerus, which is up here. The other is down lower, and it runs across obliquely and attaches into the radius here, which is why that turns the forearm into pronation. So simply, we're just going to take that ball and we're just going to just roll it around the length of that muscle and just really work that, get some blood flow into that. And as I'm doing this, I'll actually just kind of turn the forearm back and forth, supination, pronation, and just be rubbing that Tai Chi ball with as much pressure as I can into the pronator teres, just for about 30 to 60 seconds, get some blood flow in there. Now we want to do some release work. Now, to do some release work, it's very simple. We can simply just use our thumb. I'm actually going to bring my forearm up. I'm going to reach across. So I'm going to grip here with my hand, and my thumb is on that pronator teres muscle. So I'm actually going to put pressure into that muscle with my thumb, and I'm actually going to not just press down, but I'm going to pull this way towards the inside of my forearm. So I'm going to do it in this position. So I'm going to take my thumb, I'm going to push down and then rotate it. I'm gripping around my elbow, and I have my elbow bent. And then from this position, what I'm going to do is I'm going to supinate the forearm and then extend it while I'm holding that pressure. So I'm going to come back up. So I'm in a pronated state. I got the thumb right here, and I'm pushing down into the muscle, but I'm pulling towards the tissue, towards the inside of my elbow. And I'm in a pronated position. Now I'm going to supinate the arm as I hold that muscle under my thumb and then extend the elbow out. And I'm going to do that several times in that one spot, and then I'll just kind of move my thumb along obliquely across that muscle. So it's a pretty small muscle, so I might only move my thumb 2 or 3 times. But as I'm holding that pressure where I'm putting my thumb in and I'm pulling the tissue off to the inside of the elbow, I'm just going to be supinating and extending out. So I'm going to be supinating and extending out. And I'm going to do that multiple times, and that's going to get a fascial release on my pronator teres. So some rolling with the ball, and then some supinating and extension with the thumb into the pronator teres. The other thing you can do is you can use This makes it actually a little easier too. You can use a neck lax from OkraMed Health, and you can actually get these things rotate around on the neck lax. You can actually set it so that you can clamp right onto that Pronator Teres. And so I'll flex my elbow up and I'll squeeze the handles on that Pronator Teres. I'll be in a pronated position. I'm squeezing, and then I'm going to supinate and extend out. And that really can just nail that Pronator Teres and break up some of that fascia in there that's been building up, some of the fascial adhesions, just using the neck lax clamped across that Pronator Teres. So either way, you can either manually do it with your thumb, or you can use a neck lax to get in there. But that's how you break up and release that Pronator Teres, and that's going to solve problem number 1, the bicep tendonitis of the elbow. All right, so let's move on to the second part, the second problem, tightness in the internal rotators of the shoulders that's causing bicep tendonitis and pain in the front of the shoulder. So first off, why is this a problem? We have those shoulders, I'm going to exaggerate, but they're internally rotated. We're tight. We walk into the gym. We're going to do biceps. The first thing we do is we grab a big heavy barbell. We force our shoulders in external rotation, puts a tremendous amount of stress now on the bicep tendon, in particular the long head, and we start doing bicep curls. Long head of the bicep gets very inflamed, anterior shoulder pain, bicep tendonitis. What can we do? We have to loosen up those internal rotators. We're going to do a little fascia release work first, grabbing our Tai Chi ball. We're going to go transversely across the tissue here. This actually feels really good if you currently have some bicep tendonitis. This is a good home kind of therapy. Just go across your deltoid into the front of the shoulder, across the bicep tendons into the pec, back and forth for about 30 to 60 seconds. Then I'll continue, and as I'm doing it now, I'll actually kind of just rotate the shoulder, internal, external rotation, and just continue to do some of that transverse friction massage as I'm turning the shoulder in and out, and that also feels very good, gets a ton of blood flow in there. Do that first on each side, then we're going to move on to the stretches. A couple different stretches. One, you're just going to need a broomstick. You're going to reach kind of in this awkward position like this. So I'm going to grab the broomstick in this position. I'm going to have my elbow bent at 90 degrees. The broomstick is behind my arm. With my other arm, I'm going to grab the broomstick and I'm going to pull this way so that it stretches my shoulder in this direction. So from this angle, you'll see I'm pulling the broomstick this way, and I'm going to stretch my shoulder. I'm going to hold that for about 30 to 40 seconds. And I'm going to do that 3 times on each side. Just holding it nice and easy. Let that stretch out. Just go to your mobility. Don't overstretch it. Just go where it's nice and comfortable that you can feel a really good stretch. Do that on each side. That's an excellent stretch to get those shoulders warmed up. Next off, what we're going to do is we're going to just get up against the wall here. And what we're going to do is we're going to turn the shoulder into external rotation this way. And I'm going to get my hand in this position. I'm going to put it right up against the wall. And I'm going to press it flat against the wall. So I have my shoulder externally rotated, the palms against the wall, and I'm just going to press in, and I'm going to stretch this open the best I can, as far as I can, and I'm going to hold that for 30 to 40 seconds. I'm going to do it 3 times on that side. Then I'm going to get on the wall on the opposite side, externally rotate, get the palm flat up against the wall, and stretch that side also. Those are 2 excellent stretches. Do the rolling first always to get the blood flow, and then do those 2 stretches to release the internal rotation of the shoulders. All right, so I hope you found that information about bicep tendonitis helpful. Work at it like we've talked about in other videos. If it's a matter of fascial tightness and having to do some fascial release work, it isn't something that you can fix overnight. You're not going to do those stretches or that fascial release work in one day and fix a problem, but give it some work and you're going to find it to be very helpful. If you're looking for an exercise program that's going to pay attention to all these little things, then you definitely want to go to my website, www.okramedhealth.com, and sign up for our 90-day fitness program where I will customize a program just for you, consisting of calisthenic and heavy weight training to build lean muscle without the bulk. Also available on our website is my ebook, what's called the Accommodation Avoidance System. It's my book on how to perform heavy weight training while avoiding training plateaus. And then another area of our website that's been a big hit, our mobility plan. You pick the body part, and I will send you a personalized video of how to perform fascial release work and stretching on that area to help increase your mobility. If you're enjoying these videos, please subscribe to my channel, Okra Med Health on YouTube. Questions about injuries or exercises, just leave a comment in the comment section below. I always get back to everybody who writes in. And don't forget, Okra Med Health is here to keep you fit forever.